As a board-certified neurosurgeon, I'm excited to invite you into my world and share today's case. This is a truly inspiring story about a remarkable woman who came to us with progressive right-sided weakness, impaired coordination, confusion, and slurred speech. An MRI revealed a mass in the left parietal lobe, which is the area responsible for processing information. There was swelling around this mass, which extended into the region controlling movement and sensation of the right side of her body. She had a history of breast cancer, presumed cured at the time, and several years of tobacco use, putting her at risk for lung cancer. Though breast and lung cancer can spread to the brain, additional scans showed no other cancer present in her body. After discussing goals, expectations, and risks of surgery, the patient opted for surgery to remove the mass, which would allow for diagnosis and treatment. Under general anesthesia, I use neuronavigation technology, which works like a GPS system for the brain. It guides me with precision to the tumor's exact location and allows for me to create a detailed 3D map of her brain, ensuring the safest possible approach with minimal incision. After a small incision in the scalp was made, even a smaller section of bone was carefully removed. This is called a craniotomy and allows access to the brain. In this patient's case, the tumor was easily located and carefully dissected free from the surrounding brain tissue. This area was cleaned and the bone flap was repositioned and secured in place with plates and screws. The scalp was sutured closed. Subsequent MRIs showed nice resection of the tumor without progression. But unfortunately, the diagnosis came back as glioblastoma multiforme, or GBM. It's an aggressive and malignant brain tumor with a poor prognosis. Even with treatment, including surgical removal of the mass, chemotherapy, and radiation, survival may only be 6 months to 2 years. But here's where this story takes a turn. Against the odds, this incredible woman defied the statistics and has lived for years beyond her life expectancy. Each year following surgery, this patient sends me an angel figurine in honor of surviving another year without progression of her cancer. Though she wasn't expected to survive past 2 years, on my desk sits 5 angel figurines. As a neurosurgeon, these angels remind me daily of why I chose this path. This job can be incredibly stressful, challenging, and occasionally heartbreaking. However, it is most often rewarding beyond belief. Every time I look at these angels, I'm reminded of the incredible privilege it is to do what I do and to enjoy the rewards of meaningful outcomes. While GBM remains one of our most challenging diagnoses, stories like this give us hope. As a surgeon, there's no greater privilege than giving someone a second chance at life. That can be improving their pain and quality of life, improving their function of their arms and legs, or helping them survive life-threatening problems. If you want to hear more about neurosurgery stories and cases we encounter, don't forget to like, subscribe, and share. Thank you for watching, and I'll see you next time.